Hi, welcome to the channel. After over a year from the start of the current health crisis, the scientific community is still learning more about the long-term complications and effects of COVID-19. Globally, there have been more than 149 million cases of COVID-19, and research suggests that approximately 10% or 14.9 million people will be considered long haulers. Those who experience symptoms more than 4 weeks after the onset of COVID-19. While the exact cause and link between COVID-19 and long-term complications isn't currently known completely, some studies suggest it could be a result of inflammation from the virus or possibly a revelation of an underlying condition. During acute illness, COVID-19 can cause damage to the organs throughout the body. This increases the long-term health complications that individuals may continue to face for months after the initial infection. While the lungs are the first organs infected by COVID-19, we are learning that many other organs beyond the lungs can be affected. People with underlying medical conditions are more likely to have lingering COVID-19 symptoms. However, even people who were not hospitalized and who had mild illness can experience persistent or late symptoms long after the few weeks it takes most people to recover. Most commonly, these long-term symptoms can include shortness of breath, breathlessness, cough, fatigue, or even chest pain. It is common to experience breathlessness after being in hospital, losing strength and fitness while you were unwell, and the illness itself can mean you can become breathless easily. Feeling breathless can make you feel anxious, which can make breathlessness worse. Staying calm and learning the best way to manage your breathlessness will help you a lot. Now let's look at some of the ways of how you can treat your breathlessness. The first most important thing is, how do you position yourself? One of the best positions would be forward lean sitting on the table with your head resting on it, or without the table. Forward lean standing or standing with back supported. Now let's look at some of the breathing techniques which will help you reduce your breathlessness. The first and the important one is the square breathing. You take a deep breath and just blow it to the corners of a square paper. The other one is a pursed lip breathing, where you take a deep breath and you breathe it out in a pursed lip pattern. And the other important one is a prolonged exhalation, in which you take a deep breath and prolong your expiration. And the final one is the fan breathing. In this, you need to just try to blow a piece of paper repeatedly. Generally, when you recover, a lot of long haulers suffer or struggle to get back to the activities of daily living. It is important to become active again when you are recovering, but this can be hard if you feel very tired, breathless, or weak, which is normal. Even getting out of bed for washing and dressing can be a huge achievement. Save your energy by doing tasks sitting down when you can, such as when showering, dressing, or even preparing a meal. Try not to do the task that needs you to stand, bend down, reach high, or squat for a long time. Pace yourself and try to do light tasks in between the heavier ones. You may need to leave yourself time during the day to rest. Let others help you with the task that you may be struggling with. Things like caring for children, shopping, or preparing a meal, or even driving may be difficult. Accept offers of support and let people know what they can help you with. Service that can help with activities such as shopping or cooking may also be useful while you are still recovering. Do not try to take up full activities until you feel ready. This means talking to an employer about gradual return to work, taking on a role that is easier for you to manage. At this point, health experts are not sure who's going to have the long hauler symptoms or not. The best practice for prevention of having COVID-19 complications remains vaccination. Vaccines have shown to prevent severe COVID-19 illness and protect people that may have had infections previously from getting sick from a newer variant of the virus.